Let's go live to Dr. John Boffa. He's a local GP in Alice Springs. We've spoken to him a number of times in the last few weeks. He's also a spokesperson for the People's Alcohol Action Coalition. You heard what your counterpart John Patterson had to say. I guess I know you have a very similar view on all of this. How are you feeling now ahead of the Prime Minister receiving that report? Do you have a sense of hope that this is going to drive the change necessary both in the short term but the longer term as well?
Yeah, look, yes, Kieran, I do. Well, I'm much more optimistic. Like, we've seen the immediate announcement that the Territory Government made. Alice Springs has just experienced the first ever 2 days of takeaway free alcohol. I think it's probably the first town in Australia to have ever experienced that. And we've seen a very dramatic improvement. In fact, senior police are describing the data they've got from Monday and Tuesday this week as unprecedented. So total police jobs have gone from an average of 200 a day to 118 Sunday to Monday and 116 Monday to Tuesday. That's almost halved the reactive police work. And so the police are now able to be proactive, not reactive, and that's contributed to a very big decline in unlawful entries. We saw 1 and 4 on these 2 days, whereas previously we've been seeing more than 20 to 25 a day. So that's declined. Most importantly, interpersonal violence has been dramatically reduced on the same 2 days. So domestic violence incidents, which were running extremely high, were much, much lower as well, about a quarter of what they were. So we've seen some immediately positive impacts from the restrictions that were put in place, which are different to Stronger Futures, but we know takeaway free days are very effective, and we're seeing the benefit of that now, and it's giving us the circuit breaker we needed while the deliberations happen about where we go next with the Stronger Futures, bringing back Stronger Futures. But also, as everyone keeps saying, we've got to address the intergenerational issues, which are the root cause of why we're in this situation. And they need to be addressed properly. And we can't use the fact that alcohol restrictions are very effective to not get at the key underlying determinants of the problem, such as educational participation. I think I said to you in a previous interview, we're probably down to less than 30% of children going to school 4 days a week or more. Education in Central Australia for many families has become optional, and that's something that has to be worked on both in a short to medium term, as well as other issues such as bringing back CDP, creating employment, poverty. We've got to address poverty in Central Australia. But because all those things are still there to be actioned, we do need alcohol restrictions, and we need them for quite some time to come. And we've seen yet again, alcohol is a cause. It's not just a symptom of problems. This data we're seeing from Monday and Tuesday, where we just had 2 days takeaway alcohol free, it's quite stunning, and it shows us that alcohol is a cause, along with poverty, lack of education, unemployment, overcrowding.
Yeah, well, it's very clear from the evidence, both from what Matt Cunningham told us about the presentations to hospital, and then what you've told us in the last couple of days from those immediate restrictions. Before, I do want to get your thoughts in further detail on the intergenerational issues. But before we do, Darrell Anderson, the Central Australia Controller, this report to the Prime Minister that's going to be delivered, you would imagine any time now. What's the key? What needs to happen in the report for the Prime Minister to act on? He says he's going to act on it as soon as possible.
Look, I understand there's a bit of uncertainty exactly what this report is about, but I think it's primarily about what can be done in the short term around alcohol supply and what needs to be done to reduce supply. Now, from that point of view, we're hopeful that the Northern Territory Government will say to the Commonwealth, following this report, that we think we do need to bring back the Stronger Futures alcohol provisions, which are only one very small part of the whole Stronger Futures legislation. Let's make that clear. That part needs to come back with an opt-out clause, and in order to opt out, there needs to be alcohol management plans, and they need to include a broad range of things, monitoring things like interpersonal violence, hospital presentations, and participation in education as key things to look at before we start to turn the tap back on to particular living areas.
Now, on those intergenerational issues we spoke about, and obviously education front and centre, but the Prime Minister also touched on that. You would have heard his comments just a moment ago. What needs to happen there to get the resources in? Because it's not just, it's fine to say, okay, there's more funds, but you need the people, you need the teachers, you need the framework, and not just for the next couple of months, over the next 5, 10 years and beyond.
Yeah, look, this needs a really serious commitment and funding commitment across a range of social determinants, and they have to all be addressed together. It's at various times a particular social determinant might have got a focus, might have got a funding. And, and the new Labor government have made serious commitments to housing and overcrowding. But we've got to see the same commitment to education. We've got to see the same commitment to early childhood development. If you look at the 2021 data from the Australian Early Development Census, the early childhood development data on 5-year-olds in this region is still showing we've got major issues with the trauma that young children experience, their ability for self-regulation, self-control, other forms of development, cognitive development. They're not school ready, a lot of children, and that has to be addressed with a universal approach to evidence-based programs such as the Australian Nurse Family Partnership Program, child health and development centres, effective parenting programs, 2 years of preschool. We need preschool teachers in remote communities, not just in Alice Springs, and we need 2 years of preschool. This is all before we get to school. Then when we get to school, schools have to be properly funded. They need to be resourced so we get the best teachers. We get teachers who stay. What we're getting is junior teachers. They try their hardest. They're coming as locums now. The turnover in teachers in the schools in the most disadvantaged areas is a significant part of the problem. We've got to have the best teachers, and we've got to stay for a few years to build a relationship, to actually create an effective education system. That's another issue. CDEP was completely gutted, really, and that's got to be brought back in an appropriate way so we create employment. So we need multiple determinants to be addressed at once, because alcohol restrictions are effective, but as everyone keeps saying, we want to move to a situation where we don't need these sort of alcohol restrictions, because people have become resilient. They've been able to develop in ways, get work, get employment, be well educated and be resistant to the sort of alcohol dependence and unregulated alcohol consumption that we see when you turn the tap back on without addressing all the underlying disadvantage, which we know is the root cause of alcohol dependence.
Yeah, indeed. It is John Boffa. Dr. Boffa, thank you as always for your insights. We will stay in touch as this report is to be handed to the Prime Minister today. Thanks so much.